Welcome everyone to today's webinar, Transparency and Coverage, the Final Rule and Innovation to Empower Healthcare Consumers. I'm Erica Carbajal with Becker's Hospital Review, and thank you so much for joining us today. Before we begin, I'm going to walk through just a few quick housekeeping instructions. So first, we'll begin today's webinar with a presentation, and we will have time at the end of the hour for a question and answer session. So you can submit any of your questions you have throughout the webinar by typing them into that Q&A box that you should see on your screen. Today's session is being recorded and we will be available after the event. So you can use the same link that you used to log into today's webinar to access that recording. And if at any time you don't see your slides moving or if you have trouble with the audio, try refreshing your browser and you can submit any technical questions into that Q&A box as well. We're here to help. So on today's agenda, we will have an overview of accelerated healthcare trends in 2020, digital preparedness for transparency and coverage, and a fireside chat on technology and engagement best practices with OneShare Health. And with that, I'm pleased to welcome today's speakers. So first we have Kevin Reilly, who leads the health business at Velocity to help healthcare companies modernize their front and middle office capabilities through Velocity and the Salesforce cloud platform. With over 2 decades of CRM experience, Reilly created the methodology for designing healthcare operations into CRM platforms for some of the largest health companies in the world. Reilly also held executive leadership positions for health companies ranging from convenient healthcare to health insurance. Next, we have Kim Waters, who leads the network development and care navigation teams for OneShare Health, where the focus is to identify high-quality, cost-effective network solutions while teaching members to become fearless and confident consumers of healthcare. Having worked on both the provider and payer sectors of healthcare over the last 2 decades, she understands the need for price transparency. Waters has held executive-level roles designing solutions for payers and providers that allow them to reduce speed, increase operational performance, and facilitate growth. And finally, we have Dr. Russ Seacat, the Vice President of Applications at OneShare Health, a healthcare sharing ministry, and he is responsible for leading the implementation of OneShare, the Salesforce Velocity-centric platform of OneShare. With over 3 decades of healthcare IT experience, ranging from EMRs to health information exchange to big data and analytics for both providers and payers, Seacat has developed a 360-degree view of the member experience. His experience has allowed him to lead a world-class development in the transformation at OneShare to implement a 16th century sharing principles with 21st century technology and provide both members and partners with transparent, data-driven processes and outcomes. Seacat has held executive leadership positions for health companies ranging from established EMRs for providers to startup predictive analytics for payers. Kevin, Kim, and Russ, thank you so much for being here today. And Kevin, I'll now turn over the floor to you.
Thank you. I'm privileged to be here. I love the lead-in for Kim and Russ. The 16th century principles in 21st century technology, Russ, is excellent. Hi guys, my name is Kevin Reilly, and I am the GM for Health and Life Sciences here at Salesforce Industries. And so Velocity, where I came from, was recently purchased by Salesforce, and we are bringing that industry know-how to couple with the existing platform of Health Cloud to create a way for healthcare companies to modernize their operating platforms. And it's my pleasure today to be here with my friends and my customers, Kim and Russ, who are leaders at OneShare. And OneShare, as mentioned, is a leading healthcare sharing ministry. We're going to learn a little bit more about that in just a little while. So I'm really personally excited about the conversation today. Now, I have to state this going forward. You guys know the rules. Salesforce is a publicly traded company. And what we're going to talk about is centered around transformation and innovation. So while we're going to focus on how Russ and Kim and OneShare and other companies are now affected by this sea change of how they have to effectively engage with their consumers and remain compliant, we will be talking about both existing products in the Salesforce portfolio, but also potentially areas of innovation and investment. So in that regard, we ask that as a publicly traded company, you make your purchase and investment decisions based on what is available today. All right, so having said that, let's jump right to it. Now, I'm going to lead in with an obvious overstatement. Healthcare is complex. Healthcare is really complex. And when I say healthcare, I mean specifically I'm talking about the business of health, right? And the business of health is complex for a lot of reasons, but not least of which is because it's a multi-sided industry. And this dynamic between payer and provider and patient and purveyor or medtech and pharma, it creates a dynamic set of stakeholders and processes that are both influencing and interacting with each other at the same time. Now, the problem lies that each participant in each engagement optimizing, their particular to be done for others, and this creates a suboptimal experience. So the goal of a well-functioning system, and certainly the goal of Salesforce Industries and the part that I'm responsible for, healthcare, is to do better and do it with less and for less without breaking what's already good about what we have today. So that's going to be our goal. That's going to be our conversation today. Now, if healthcare is change, 2020 is the year of change. And I saw a funny commercial by a dating website this week, a colleague sent to me, where a devil goes on a first date with the year 2020, and it was a perfect love match. And maybe I'll include that in the link that we sent around to everybody. I thought it was absolutely apropos for the year 2020 summed up. And things aren't going to change in regards to the pace of disruption. Now, healthcare has been about consumerism for quite some time now. But with COVID and with the expeditiousness of the need for applying change, right? So we've seen years of change happen in weeks. But we don't expect things to actually slow down in 2020. So let's look at some of the major trends in change that are affecting healthcare. First is payer and provider business models are changing. Vertical integration is happening left and right. Acquisitions and partnerships are surging. They're providing high quality care at lower cost. Now you look in 2020 alone, there's been over 20 payer provider partnership launches. For example, Oscar Health released news that it plans to partner with Holy Cross Health and Memorial Healthcare System, two entirely different healthcare systems, to launch a co-branded MA plan. This won't change. Vertical consolidation, whether it's CVS and Aetna, or it's more on the cutting edge of cross-pollination with Oscar and a local health system, is going to continue to change. Along with changing business models are changing payment incentives, so reimbursement innovation. The industry, thank God, continues to move forward towards value-based care. We cannot continue to exist in a fee-for-service model where almost 19% of the gross domestic product of the U.S. is spent on healthcare. That's amazing, and it's frightening. And so restructuring reimbursement so that people are paid equitably and fairly, but we lower overall fraud and waste and cost is essential. But it takes the machinery and the technology to actually drive and ensure that risk sharing can happen to encourage low-cost care, but enable the machine not to break down. I'm glad to see that the triple aim became the quadruple aim, because it was essential that we don't just create great care at low cost with great quality outcomes, but do it on the back of the provider, which is historically where a lot of the business model innovations have come through. So keeping in mind that we have to keep providers whole in this process, seeing innovations around reimbursement have been really key. So things like site neutral reimbursements, whether it's for bundled payments or for fee for service, are a great example of continuing investment in interesting and innovative financing models. Now, one of the most amazing and controversial and innovative concepts to come out of healthcare, in America at least in the last 10 years, was the Affordable Care Act. And 2020 did not let up on the amount of change that was facing ACA. Now, including the expansion of the marketplace and things like the litigation, California versus Texas, you've got the effect of COVID and its impact on healthcare accessibility for individuals who are not employed. So increasing unemployment rates, changes in premium, these are all affecting each other and the country at large. And Kaiser Family Foundation estimated that as many as 85% of the people who were at risk of becoming uninsured due to job loss, right? Job-based coverage is now at risk. They could all be eligible for Medicaid or subsidized marketplace coverage. That is a significant potential impact to the enrollment rolls for ACA. Now, technology has come right on time this year and been able to apply a manifest sea change during this crisis. When you can't go see your doctor, what do? Well, telehealth, it became a forcing function. So one good thing about COVID, if one could say that, is that it became a forcing function for us to apply technology to bring healthcare into the home. And we've seen that historically with aging in place and palliative care, but actually having daily care administered in the home through telehealth has been a major initiative for 2020. And it is one of the bright spots that we've seen this last year. And so just anecdotally, the number of telehealth visits over the past year has increased 50% compared over the same period in 2019. And the uptick has impacted everything from how health plans are creating amendments for their coverage policies, how they're reimbursing providers, and from my point of view of the world, how people are using scalable technology solutions. Now, last on this list of big themes and big trends is price transparency. And that's really the theme for the day. So price transparency has now been in place in the final transparency and coverage rule since last October. And it first came out and affected providers. And now you're going to see the focus begin to affect payers as well. So this will change how healthcare consumers engage and get guided to the most cost-effective quality care. So at first blush, wow, that seems great. Anything we can do to impact how information accessibility and guided experiences affect how an individual consumer thinks about and then engages proactively or retroactively or as needed into their healthcare is a good thing. So that's what we're here to talk about today. We're going to focus in on price transparency. And if you really think about price transparency in the aggregate, well, it affects every other trend that we've already got in front of us. So how does price transparency affect the consolidation of these business models? Well, the more you see vertically integrated health plans, i.e. payviders, Kaiser Permanente as an example, Baylor, Scott & White, Ascension, what does that impact their bottom line as price transparency occurs? I think that it's a benefit for them in many cases because they've probably got lower negotiated rates with their in-network, in-system providers. And so this becomes a way to really highlight that. What about reimbursement innovation? With price transparency, all of a sudden everybody's going to know who gets paid for doing what. And this elevates not only cost, but also quality. How does reimbursement now take into account price transparency? Will price transparency, in effect, change the way that people shop for Affordable Care Act plans or for Medicare Advantage or for group for that matter? Will eligibility change? Will people be searching for not just are my doctors in network, but can I get this procedure done and what's the cost to me and what's the optimal construct for in-network usage and pharmacy and medication usage based on the information I as a consumer am giving you? Shopping by predictive incident is coming down the pike, and this is a transformative digital experience. This can't be done without the use of technology. And then for telehealth, how does price transparency affect telehealth? Well, I can tell you from my point of view and that of my family, and my wife and I had this conversation as she's the decision maker in our household for healthcare, being able to have easier access to my favorite doctor, who's here at Baptist Health System in Jacksonville, is mandatory. I'm only going to pick a plan that keeps my doctor. But getting in to see my doctor on an annual basis is actually pretty tough. And it's amazing how busy they are and how much they work. but it'd be great if I could somehow effectively connect with him in a telehealth environment. So would I choose a different plan? Would I be willing to pay slightly more, or effectively choose a different benefit construct to be able to have telehealth with my desired care provider as part of that? Absolutely. So all of these trends and all of these implications are affected by this price transparency rule. And that's why we chose this as the topic. Rather than any other trend, we think this is going to have more manifest change across all of the existing and changing dynamics of the healthcare industry. So let's double click on, as we like to say at Salesforce, let's double click on that topic. And what exactly is the rule, and when should you prepare? Well, now officially, the Executive Order 1387 is referred to as Improving Price and Quality Transparency in America Healthcare to Put Patients First. Whoever came up with that title probably wasn't trying to market that. It's kind of a mouthful. So let's just call it 1387 or Exec Order 1387. And there's quite a few stated purposes with this executive order. First, it's going to provide consumers with both price and benefit information that will enable them to evaluate healthcare options and make cost-conscious decisions. This, in part, will reduce surprises in relation to a consumer's out-of-pocket expense when they are receiving care. By knowing something up front, they're not going to get that shock after they receive that care. It will also, theoretically, I believe in this, create a very competitive dynamic that will begin to narrow price differences for the same service in the same geographic market. That's very important because there is a significant difference in negotiated rates between payers and providers in the same geo for the same service. And not just because of quality, a lot of it has to do with the fact that great negotiators wind up getting better rates. Now, we believe that this will foster innovation. Kim and I and Russ were talking in the green room before the call, how this is actually going to significantly foster innovation for not just providers, but for the public sector to come up with solutions for folks like Salesforce, who are going to create solutions that are going to drive the information necessary to support these informed, intuitive, price-conscious consumers as they're making decisions at different stages. Stages for shopping, stages for enrollment, stages for predictive accessing of care, and for next best action after you figure out that, hey, maybe I'm sick. And so overall, I think what this is going to do is have the best effect on lowering healthcare costs of anything that we've done in quite some time. Interoperability is another major initiative, and we have an entire team dedicated to that here at Salesforce. So the cross-information exchange of that information and how much that's going to affect the cost of healthcare is just as significant. But we believe price transparency is fundamentally going to be a major initiative. Now, what does all this mean? So, if I was to reinterpret this, I would say that this is now going to require health plans and any issuer to disclose their price and benefit information in a way that is analogous to their explanation of benefits. I often make a joke when I talk about an explanation of benefits or an EOB. They're neither an explanation nor a benefit because they're not accurate and they're not clear. So to present estimated cost sharing liability for me, the consumer, this is the key part, prior to the receipt of care in a manner that I can understand is a game changer. And Russ and Kim and I are going to talk a little bit about how that affects both health plans big and small. Now, to be sure, this rule affects individuals and group lines of business, fully insured, self-funded plans, and in-network providers. And it also actually applies to how an issuer or a plan allocates unique amounts for services and items furnished to out-of-network. So you can actually understand how much it's going to cost you or how much at least the plan will reimburse you for out-of-network services during a specified time as well. Now, here's the kicker, and this is the funny part. As a technologist, when we saw this part in there, it kind of made us smile. This information must be made available via the internet or via paper. When requested in paper format, right, payers will have 2 business days to fulfill the request. Now, wow. first off, paper forms should be outlawed. They shouldn't even be an option in this day and age. It's the equivalent of laying down telephone poles and landlines in the Antarctic. Let's just be smart. Let's digitally transform. Let's put up a cell tower. We have the technology today, so why would we mince about with the concept of paper forms? Now, in our point of view, as technologists at Salesforce, we broke down what are the components that you need to have to make digital transformation towards price transparency a reality. Integration is key. We talked about interoperability. The ability to actually effectively market to somebody through a journey is going to be essential because you need to give them information at point in time. Plan design, fundamental, as we discussed. Changes to coverages, changes to benefits, changes to how you communicate those. You've got to change the way that you quickly create new products and bring them to market. At the same time that you're creating the coverage in your PPO or your HMO, you've got to apply that same modality to your network. You've got to negotiate into that price transparency concept into the network so that care management and accessing of that care management to exercise the plan benefit by the provider, by the actual member themselves, is all cohesive. It's not just about the cost. Obviously, that's step one, but step two is the outcome that derives out of a choice that is made based on quality and cost. And so for the patient to get the outcome, we go back to that idea. It's not just about the marketing journey, but the ability to send somebody to a learning system so they can follow a trail, as we like to say at Salesforce, towards their eventual understanding of their condition and what the next best action should be, and then giving analysis to those risk-bearing entities, whether it's the plan, whether it's the group that's self-funded, or it's the provider in a risk-sharing model, to analyze, am I at trend, not just in the aggregate, specifically with these patient members. This is a forcing function for our industry, and I would be remiss if I didn't say that we're taking this really seriously at Salesforce, and it's why we're building purpose-built products. And part of the Velocity acquisition was bringing in that operating platform for health plans, things like catalog and rating engines, quoting and enrollment, renewals, onboarding, enrollment, ongoing benefits maintenance, network and pharmacy management. All of these elements are part of the Salesforce ecosystem for health plans. And we are engineering these to meet the compliance, but more importantly, the experience that is coming out of the effect of this price transparency rule. So without further ado, what I want to do now is talk about what this means in real time with Kim and with Russ. Now guys, first off, what is a healthcare sharing ministry?
Well,
Russ,
I'll
Kim?
take that one, Kevin. Yeah, absolutely. And first of all, thanks for the overview and the presentation. Very informative. And Beckers, thanks for having us here. Healthcare sharing ministry is probably something that most attending are not familiar with. Some may not have even heard of. But a healthcare sharing ministry, or an HCSM, like OneShare Health is an organization, a faith-based organization, through which like-minded individuals can come together to share in the paying of each other's medical expenses. This is not a new concept, although you may think it is if you haven't heard of it. It's actually been around since the 16th century when, villagers would gather in the square and share pieces of silver when the need arose. As it's stated in the name, Healthcare Sharing Ministry, we are a ministry. In fact, we have a full-time chaplain on staff. Pastor Jeremy Farmer does a great job keeping our primary focus. Have a prayer line, several means for which one can access prayer requests. We are a nonprofit, work with and support multiple charities, and we have a statement of beliefs that must be agreed to in order to become a member. So because of those fundamentals, we have a slightly different, maybe very different view of our members and the type of stewardship that we provide them. As importantly, especially from the transparency perspective, is to state what we are not. And we are not insurance. Major delineation there is that we do not guarantee payment on every sharing request. Sharing request being analogous to a claim.
Right.
That being said, I would say I'm very proud to say that we have paid since our inception 100% of our qualified sharing requests, and in several instances fulfilled some sharing requests that actually were not qualified just because it was the right thing to do. But that is, in a nutshell, is what a healthcare sharing ministry is.
All right. So if it makes sense, I get it. This rule seems like it's going to affect you guys in a big way. How would you see it as an opportunity?
Well, yeah, Kim can go into more detail on this. Oh, go ahead, Kim.
Yeah, go ahead. Our members are often very, health conscious, cost conscious consumers that are kind of wanting to take control of their healthcare experience, right? So our model really lends to being good stewards of the dollars that come in the door and focuses on personal responsibility. So for us, we offer a care navigation service that really focuses on helping members find quality providers at a fair price. So seeing this rule come out was exciting for us because we're already doing some of this. And as you mentioned earlier, Kevin, facility pricing can vary, 1,500% within the same zip code. So, our goal is to provide some awareness. It's crazy, right? Our goal is to provide some awareness and transparency around that. So, rather than sitting with your surgeon and him saying, hey, do you want to have surgery on a Wednesday or a Friday? The question should really be, where am I going to have surgery and what is that going to cost me? So this rule is really going to allow us to empower and incentivize members to really shop for that and engage in that service that we offer. Kind of good example, we had a patient that needed a knee replacement, went through our care navigation team and got to keep their surgeon, same surgeon, changed the facility and saved $10,000. So we actually have opportunities for members that member was actually even we were able to waive their member responsibility because of the savings that was there. So it's exciting to see the rule reflect some of the things that we're already doing. And that really is going to allow us to take our steerage opportunities kind of to the next level.
So, okay, this leads into our next question. What's the engagement model? You've given us an example today where you've got a care navigation team. Somebody calls in, and I know you guys. You know your members or your shareholders, and it's very clear that person-to-person interaction is key. But as you scale, as you get bigger, as you think across the larger spectrum of just the sheer number of people that are going to be coming in for some form of care, how do you think about this in regards to digitizing it? How do you make it easier and more intuitive to make the best decisions, which I think transparency is helping people do? Let's make the best decision for quality and for cost. What vision do you guys have for this?
Yeah,
I'll start and I'll pass it off to you.
Go ahead, Kim.
This is fun.
Go ahead.
Sorry, I'll pass it off to you in a second. So yeah, we're it's fun to do these live, right? So we're working to engage these members through a lot of different avenues. Through pre-certification, we try to catch a bunch of stuff up front. We're working with Russ and the Salesforce team to automate a lot of that process, engage in, get member portals out there, provider portals.
So let's be clear on
that.
Kim, your job is to negotiate with all of the providers and to oversee the consumers. And
right.
Mr. CCAT is your partner in crime to bring a digitization to that. How do you go about that? How do you first think about what's the optimal process and experience that you want to create? How do you then partner with Russ to determine if that's something that he and his team can bring forward on the technology that you guys have chosen to use?
Okay, so I think first and foremost, we are transferring from a kind of paper world, right, to a digital world. So we still have some forms that have to be filled out in fax and all of those fun things. It's amazing that fax is still a thing.
Can't get away from it. Absolutely.
Right?
Can't get away from it.
That thing called HIPAA and PHI, right? So we really sit down with Russ and say, okay, we've got this opportunity. What does this look like right now? This is pretty manual, and he really brings some efficiency to all of those processes. So to your point, it allows our members to engage not just with our team, it allows us to be bigger than we are, right, in scale, and allow members to do some self-shopping, if you will.
Excellent point.
Yeah, ahead of time. So Russ, you want to expand on some of that?
Sure, yeah. What we're trying to do with, as mentioned earlier, bringing, implementing 16th century principles with 21st century technology.
I love that. I love it. I love it.
It's exactly what Kim is talking about. She and her team have done a fantastic job of putting programs in place, building networks, building trust within providers, and trust, I think, here is probably the fundamental tenet, and I think that begins with transparency. In anything, and especially in this day and age with consumerism the way it is, Cyber Monday was last week, and with the explosion of telemedicine, being able to engage digitally now, and to do so in a platform that you trust. That content, those practices are all being digitized, if you will, within the Salesforce platform. Salesforce and Velocity are now Salesforce Industries, and we're just providing the tools to not only provide to the members, but also to our producers and our providers. And really, this is evolving into a platform of collaboration, where we have not only our resources interacting with members, we have some of our partners interacting on specific cases, so we're all seeing the same thing and doing not doing the same work twice, but being all parties, all respective parties, the consumers, providers, and producers being able to come together into one spot and see the same thing makes things much more efficient, and that there's transparency that's inherent to that. So that actually builds trust in a very big way, and that's what we really need to do to engage the consumers.
So, all right. So you're the thematic is trust. Let's take an example. When we were prepping for this, we thought, let's apply this towards something very specific that I know you guys have put a lot of time and attention on, and that is your shop enrollment process. So first Russ and then Kim, okay, how is that design based on trust applied, and how do you incorporate these transparency concepts into your shop and enroll process? And if you're still in the process of doing that, hey, great. Let's talk about what is implied with the need to constantly be able to change, and how you're doing that in the redoing of the one share shop and enrollment process from end to end. So Russ, I'll start with you. How are you transforming shop and enroll? How are you applying trust? And how are you embedding these new transparency rules into that design concept?
Yeah, outstanding. So we experienced hypergrowth since our inception, the first year primarily, and quickly outgrew the system that we had in place. So we decided we had to expand. We had to move to a system that would support our growth. All of us had, well, not all of us, many of us had experience working with Salesforce. So that was, from a CRM perspective, that was obvious choice to look at first. And many of us were very surprised at how Salesforce had grown into Service Cloud, Health Cloud in particular, the Community Cloud, and so on. So we started looking at it much closer, and then actually Kim was introduced to Velocity at the time, of course now Salesforce Industries, and Velocity Health specifically, which you were running then, Kevin. And we started looking at this, how we could really build a platform that we could build from the ground up from our product catalog as the foundation and build that up forward and then finally present it to the end user. And as you mentioned in your introduction, how complex healthcare is, right? What we're striving to do, and when we talk about shopping from the very beginning, shopping for a plan or whether we're shopping for a procedure, it is
right.
try to
right.
make it very simple, right? We want this to be, we want a consumer to be able to understand what we're presenting to them in terms of pizza and football. You know, something pretty much everyone can get a handle on. So being able to break it down like that instead of the complexities that are inherent to healthcare now, that's been our driving goal in how to do this. And transparency is key from the very beginning because we are not insurance. We want to make sure that everyone understands that, understands exactly what we are and when they come to join. And then once they're a member, then of course we're getting into what Kim is doing with respect to making sure that they're understanding, you know, prices and providers and facilities and those sorts of things. Again, in very simple terms, make it very easy, and making that very available to all parties involved. And that's really the gist of what we're doing there. Because of the way we built this and because of continuous innovation with Salesforce, it makes it very easy for us to go into the product catalog and break things down to like the CPT code
right.
level, put things there, which makes it much easier for that shopping experience and all the processes that, you know, that Kim has put in place. We're just here to digitize that and make that a reality and accessible for all our users.
So is that the partnership, Kim? You know, I love Russ's statement about shopping for a plan or shopping for a procedure. It is shopping. It is shopping in both circumstances.
Right.
Although historically we haven't thought about that way. Does that partnership model work for you? You've got enough to do figuring out who I can negotiate with for what service at what code level. What's the agreement? What's the benefit then look like to support that agreement? And being able to work with Russ in that manner for him to then digitize that how's that working out?
Yeah, it works really well. I mean, we sit together multiple times a week, and they do a great job of listening to our needs and then turning that into reality. So it's to Russ's point earlier, it's a huge collaboration effort, a lot of testing and working and listening and bringing it to market. It's been a lot of fun. So and to his point earlier on the, you know, we're able to bring in the network pricing too. I know that we're just starting to add the network management modules as well with you guys. And so able to take that pricing structure down to that CPT code level, whether it's a bundled service option or a fee-for-service option today, we're able to build tiered networks even and tie that into their product catalog as well. So we've really been able to kind of pivot and respond to needs with your platform.
So let's talk a little bit. What's the roadmap for you? You've been working really hard rolling out Shop and Enroll, and that implies, Kim, you've defined a product, you've defined how you price that, you defined how, Russ has defined how you want them to shop. You've given opinion on aspects of that shopping all the way through enrollment. What's the roadmap? What's next? What are you doing and how's the team structured? Will you guys continue along the same process? Does it manifestly change how you guys are working together as you're moving into adding more of the network management model? And I know we talked about the claims just last week. What do you see different going forward?
I think, you know, with Shop and Enroll, it's, you know, been a different, you know, set of staff that's been able to focus on that. So I'm excited to work with Russ even more, you know, at a detailed level and with you guys as we're being creative and what we want this to look forward to. So whether it's the network module or the sharing aspect, SharePoint that claims that side of this, giving our teams transparency, giving our teams transparency on the phone to be able to provide that education to the member and the provider and really build trust on the provider side just as much as the member side, as Russ said earlier, just because we are kind of a unique animal in the market, it really helps our member experience as well. So all of the things that we're doing on the provider side and the network side and the sharing side is really helping the member experience all the way around. And Russ's team is helping bring that to life.
So what do you predict will be the outcome of the experience when this rule gets applied? What do you envision for your policyholders, or again, shareholders, right, is really what you guys refer to them, your customers. What do you envision as their experience when they're trying to make a decision about where to go get care? And you gave a great example at the beginning where a person calls you up, they're trying to find and work with you the best quality negotiated rate. How do you see that going forward in more digital format? Will it be partially digital, fully digital?
Yeah, I think for our team, we'll kind of phase into that, right? So I think for now it'll be partially digital, moving into, a fully digital experience. We definitely have a high touch model at OneShare. So we like to engage with those members one-on-one, like you mentioned earlier. But I think giving them the ability to meet them where they are and they need where they are. So you talked about how are we going to engage them. One of the things is just kind of identifying that they may be on a path towards a certain need in care and trying to be very targeted in marketing efforts, even on the front end with members to say, hey, have you thought about this? Or don't forget to shop before you go make this decision, and try to meet them where they are. I don't know very many people that walk around with their membership guide, or, if you're on the commercial side, your Blue Cross Blue Shield guidebook, you're not walking around with that thinking about what all tools you have available to you. So we're really trying to work even with our marketing team to get out in front of members when they have the need.
I once heard healthcare
starting to engage them early.
No, you just, like, you've inspired my thinking. I've heard healthcare described as the product that everyone owns and no one understands. And so your point about, the whole premise of the rule was people got sticker shock when they went in to get a procedure, like, oh my God, I'm paying $10,000 a year and I got to pay $10,000 now for that thing. So I think you're spot on. People will probably not change the way they think about getting answers. It'll be as needed. But if you could be predictive, as you suggest, and market to them based on decision areas that they're probably more likely to make based on their care and their past sharing history, I think that would be really effective. And I think that would lead to a deeper trust of you being on their side and helping them navigate the healthcare system. I really like the idea.
Kevin, I would add to that something that is a bit obtuse, but still very much in this vein, and especially now, medical tourism, right? It's been around for a while. It seems to have kind of taken a backseat. You don't hear a whole lot about it now. But this is effectively just traveling locally, right? Instead of flying overseas for procedures and those sorts of things. This is now providing that type of direction where you can. If I have something I need to do, well, let's see, I'll get my best bang for the buck and see if we can't take care of it locally.
Russ, you have the best summarizing things into succinct, the 16th century, 21st century, and you're right. This is really effectively helping people navigate the geography, cost, quality structure of their own healthcare ecosystem around them. Well said. Well said. All right. So, what's the advice for? And Russ, this goes to you. What's the advice you have to folks who are trying to tackle this same problem? Is there a step-by-step that you would recommend? Is there a do this before that? What in your trials and tribulations have you guys seen that you might be able to offer to our audience today about someone who's trying to tackle this same type of digital transformation, and explicitly towards any member engagement, but really explicitly towards transparency, if you can?
Yeah, that's a hard one, because many in the industry that are being affected by this are entrenched into systems that they've been using for a long, long time, and that's really hard to change and pivot. We are fortunate that we started this from scratch. We have a fantastic Salesforce team with a great admin in Carlos Boyd, and developer in Jaywan Pasupatelli, and a reporting wizard in Kenny Wagura, and they all support. They all look at a solution from their own particular optics, but they're all well versed in the other aspects. So they're able to develop things very quickly, pivot on a dime, which we need to do often. But we were able to start from a very, a foundation of building the product catalog, start from there and build everything up on top of that. And having that strong foundation, you can't beat that. But I do think that if I was not in this position where I was in a very established system that had to be worked with, I would say the best thing you could do at this point, especially in light of transparency, is just to really make things as easy as possible for the consumer. Things are still, they're still murky and things are still difficult to navigate. But you can still do that even if you don't have the fundamental system behind it. But I think we are finally, after healthcare has threatened to be a consumer-driven industry for a couple of decades, with the pandemic and the explosion of telehealth, I think that, as you mentioned earlier, disruption is here to stay, and we're moving in that direction. So building that trust via transparency is what's going to have to be done.
Kim, I will ask the same question of you. I think about you and Russ as typical to folks at health plans, and providers too, who are affected by this rule. You're building a bridge, except you're on one side of the river where you're managing the mechanics of the plan, the mechanics of the negotiated contracts and fee schedules, and Russ is on the other side manning the experience there. How do you build a bridge from two sides of the river and make sure it meets in the middle? What advice do you have for our listeners?
Yeah, I think just those of you that are entrenched in the operations, sometimes operations working with dev teams can be a challenge just because you speak two different languages. But I think, if you don't find yourselves where you think you're being heard, do a lot of, I heard you say this, right? And a lot of playback. I know we do that a lot to say, okay, I think I heard you say you need this, right? And we walk through that together. And, some groups I know in the past we've worked with that have kind of an intermediary that know how to take those business requirements and talk both languages. But I think Russ and his team do a great job of, we do a lot of playback, and find that we are usually on the same page when we do that.
Good point.
So I think you guys have a lot to offer. It's funny, you're a unique, innovative offering in a highly transformative, highly complex business model. And I appreciate the fact that you guys chose Salesforce. And so one of the questions that just came up, and I would invite everybody who's listening right now, if you have a question, we try to answer them as we've gone along. And if you have any others, please ask now. One of the questions was, how did you go about choosing your platform? Russ, Kim, either or both, how did you guys go about choosing the right platform to basically run your end-to-end operations?
Well, this probably falls in that category of better to be lucky than good. We started out in dire need of a CRM platform, so of course you're going to look at Salesforce first. As I mentioned earlier, several of us that were involved in the search had used Salesforce in the past, but primarily as a CRM. So for me personally, realizing that Salesforce had become what it had become with Service Cloud, for instance, which we now use for our call center and for all of our documenting our interactions with, be it consumers, producers, providers. And then looking at the other specific applications, such as, what is now Salesforce Industries, and then looking at how we can outreach via the community model. all of a sudden we realized that we had a platform here that had everything we really needed. And then it was just a question of how can we get the right resources to help us put this together and transform, ideas like what Kim has into a platform that, one, is not developed just by a bunch of developers, right? Because that's destined to fail. By having being able to find something that's like this that scales, and that was very important. And of course, we know Salesforce scale is probably bigger than we will ever need it. But the fact that it does scale, that was very important to us. So it was really the ability to find a platform that allows us to put everything in there, which is, why we call this internally one source, because it's one source for our data, one source for information, it's our system of record, right? So one source of truth. But we had to have a system that could do all that without having things in different silos, and there weren't a whole lot of options out there. So this one source, hopefully in the not too distant future, will provide that one stop for shopping for everyone that needs to do it.
Kim, here's one for you. Tell me if this question makes sense. What are your best practices to connect and coordinate data for consolidated pricing reporting, excuse me?
I think right now we are in, kind of to Russ's point, we're in a lot of disparate systems, which is probably not uncommon for most of you in healthcare. I think we all are used to logging in the multiple platforms to handle whatever tasks we have at hand. So this is definitely allowing us to bring all of our different pricing strategies and network strategies, our different types of fee schedules into one place. And I know we've been, one of the things that we really enjoyed when we were shopping for a platform was sitting with some from your team, Kevin, and Jeremy Waite and Jeremy Bishop, and just kind of dreaming of, okay, what could we do, and can we do this, and can we do that? And being able to bring together all of the different, our different fee schedules and different pricing structures was a really exciting thing, rather than working out of Excel or, having to send something off to get repriced in a different section. To have all of those things in one place really empowers our teams to be successful and give good information. Again, just building that trust all the way around.
It's funny, Kim, how much of health insurance is run off of Excel. Frightening if you probably actually tallied up a number of things.
It's very true.
You did, yeah. So, all right, here's one I'll answer. What are Salesforce's plans to address healthcare consumerism around transparency in the near-term future? So I would say, first and foremost, Salesforce made a major investment this year in buying Velocity, and so Velocity brings into Salesforce a complete end-to-end capability set to run a health insurance plan or a healthcare sharing ministry, as is the case with OneShare. Now, first, that means product catalog, and Russ has mentioned it a couple of times today. The ease with which you can actually create and modify benefit constructs for us was this was the foundational stone with which we built everything else against. The ease of changing your product to meet changes in regulation, changes in consumer demand, for us was mission critical. And so where you take it from there, how you expose it to the buyer, and then put decision support around that is really critical. With Salesforce buying Velocity, we have been opened up to a brand new set of capabilities that are amazing. And for me, the next step is really about connecting what we do from a capability set around health plans and health sharing ministries into Einstein, Automate, and Tableau CRM. So very specifically, this is how I would answer it. There are artificial intelligence, next best action, and heavy-duty analytics engines that are available to us now to apply the transactional engines that are creating all this data, from catalog through pricing and shopping and enrollment, through effectively having claims or share requests, as OneShare calls them, and managing and analyzing that data so that you can determine, given this person and their effective shopping habits, what is their propensity to choose this product over that? Given this person and their claims history or sharing request history, what is their propensity to take action on a recommended next best action? What clinical care programs should we get them invoked into? It's the application of the intelligence with the analytics and then driving further automation. That's where we are investing. And I think that's what's going to make transparency really come to fruition. I envision a world where I or my wife, as I said, is the decision maker for healthcare in our family, can say that my son wants to go in to get something done against his shoulder. What are my options? So what we're also investing in is technology that will allow us to move from natural language conversations into healthcare codification. Russ talked a little bit about CPT codes. For those of us, for the 99.9% of the world that doesn't know what a CPT or an ACT or a CDT or a HCPCS or an ICD code means, we can't say, right? We can't walk in and say, tell me about CPT code 135782. No, you're going to have to express it in common language and then have the machine infer from that what is it you're trying to state and how will you respond as a machine using artificial intelligence. Is this what you mean? Is this what you mean? And then narrowing that search down so someone can actually self-serve. So that is very critical. And you can only do that at scale with artificial intelligence. And as the machine learns, the more often it hears that natural conversation of someone asking the question, it can then present what the next best rank order answer would be for them to pick this plan, go see this provider, enroll in this care program. So definitively, our plans to address consumerism and transparency are invest more in getting our artificial intelligence and our analytics to couple with our transformative straight-through processing tools. I'm looking at the time, and it looks like we have, yeah, please, Russ, comment on that. Absolutely.
Yeah, let me just add on to that very quickly. We were inspired by the keynote at Dreamforce last year, which I believe showed State Farm and just the capabilities that there were State Farm agents, and they were utilizing the capabilities that you just described. Phone call comes in, is transcribed by AI based on the natural language processing, articles are brought up, policies suggested, and so on. We're working very closely with our system integrator, Arxona, who's been fantastic, by the way, to develop just that with a 360-degree view, bringing all this information together, utilizing AI. We bought some Einstein licenses early on just because we wanted to build the analytics as we were building the system. But we're looking very, very much forward to being able to do that here in the not too distant future.
Well, I'll be doing it with you. I love you guys. Absolutely. I love working with you guys. It's fun. It's fun to dream together. We were joking how next week we're going to have to come up with some reason to get on a phone call together just so we can make it 4 weeks in a row that we've been thinking through things. I really appreciate you guys choosing us as your vendor. It's really meaningful. The work you're doing, this is the worst pandemic in my lifetime. It's absolutely frightening. We're really grateful to play a part in doing this. And for you guys to spend time today to talk to us about what a health sharing ministry is, but more talk about how you are suffering from many of the same challenges that our other health plan customers and prospects are looking at. And what you've done is, I'm really grateful for it. It's very generous. You guys are extraordinarily generous with your time. And so I would ask everybody, if they want to learn more about OneShare, it's very easy. Just do a Google search or contact Salesforce, and we can put you in touch with Kim and Russ. And there's a lot to offer there. It's a very interesting model. I want to thank you two for everything you do, for always, letting us be your vendor, but most importantly for what you guys actually do for the healthcare system. So Kim and Russ, thank you guys. I really appreciate your time today.
Thank you.
Now, guys,
thanks for having us.
You bet. Of course, guys. As a final reminder, we're going to send out a link to the recording, to some of the information that we have discussed, the ruling itself. It's in the context of this slide. And then there are some links that you can click on to find out a little bit more. If you're interested in our thoughts and thought leadership around health plans and providers, you should click on the Payer Principle podcast. We have a series of podcasts from our industry experts, our clinicians, our physicians, our deep health insurance industry experts, tackling many of the problems that all of you face today. We also have a predisposed opinion on what's the best way to actually help guide intuitive conversations specific to healthcare. And that's available on our healthcare engagement guide. And then finally, if you guys have not looked at or considered looking at Health Cloud, you can get a free trial of Health Cloud just by clicking on the link there. Of course, I am super glad to talk to anybody about this use case or any other use cases and what we're doing to help continue to transform healthcare. So with that, I would like to say sincerely from all of Salesforce, from my Ohana to your Ohana, thank you very much for giving us your time today. We will send this information out to you. Again, thank you, Kim. Thank you, Russ. And I hope everyone has a great holiday season. Please be safe. And thank you for all that you're doing out there on the front lines, everybody.
You as well. Thank you.
So that is all the time we have for today, and I want to thank Kevin, Kim, and Russ for an excellent presentation and Velocity for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you again for joining us today, and we hope you have a great afternoon.